Alright, this is a model of the heart, and you can appreciate how the heart is divided into four chambers. We have the right atrium, the left atrium, the left ventricle, and the right ventricle. So we can kind of open it up a little bit like this. Actually, let's begin, however, by closing the heart up. You can appreciate how the right ventricle is blue in this particular model to indicate that it's deoxygenated blood that's traveling to the right side of the heart. The left side of the heart, however, gets oxygenated blood, and why this is orange we'll never know, but nonetheless it is oxygenated blood as opposed to blue, right? Okay, good. Alright, well, let's take a look first at maybe a few grooves that we have around the heart. In the area of the cardiac skeleton is a groove between the atria and the ventricles, and this is referred to as the atrioventricular groove. There's also a groove in the region where the wall between the two ventricles lies. You can appreciate that this is a wall between the two ventricles. We call this the interventricular septum. And likewise, where the septum exists, we have a groove that these blood vessels rest in, and therefore this is the interventricular septum with the interventricular groove. So the groove is the interventricular groove. All right, well, let's take a look at some blood vessels. So I'm going to begin by taking this heart model off. Let's look at the big blood vessel first. This great big one is the aorta. This is essentially sending oxygenated blood throughout the body. And of course it's arising from the left ventricle. This large vessel in front of it is also an artery, believe it or not, in spite of the fact that it is blue. And this is referred to as the pulmonary trunk. The pulmonary trunk is going to be branching into two pulmonary arteries, a left pulmonary artery and a right pulmonary artery. Now notice that these pulmonary arteries are blue, right, in color, which means that they are transporting deoxygenated blood. But they are arteries by definition, because arteries send blood away from the heart. So both the aorta and the pulmonary trunk are arteries. Likewise, veins send blood to the heart. Here's a very large vein and another very large vein, and these two collectively are called the vena cava. This would be the superior vena cava. This is the inferior vena cava. Again, blood is brought to the heart via veins. Now, blood is coming from the lungs to the heart on the left side. So we also have veins on the left side, but these veins are red because the blood coming from the lungs is oxygenated blood. And so these would be the pulmonary veins. So there's two here on the left side draining into the left atrium, and there's two on the right side also draining into the left atrium. Okay, good. Well, let's talk about the blood vessels that feed the heart itself, feed blood to the heart itself, and drain the heart. Let's begin by looking at two that are associated directly with the aorta. So coming off the aorta is this one on the right side, simply called the right coronary artery. And then there's a little stubby one on the left side called the left coronary artery. The left coronary artery is going to branch into two arteries. This one going around the heart is the circumflex artery. Again, that's the red vessel. And the one going down here in this interventricular groove, the red one, is the anterior interventricular artery. If we take a look down here, this right coronary artery persists all the way down, and we have an artery that kind of goes off the side of the heart here. We're not going to be bothered with these others, who knows what they're supposed to be, but this particular one is the marginal artery. So this particular artery at the base here is the marginal artery, really not the base of the heart. This is going more toward the apex, the point of the heart. But I'm just referring to the series of arteries that would be at the base of them, right? And so this again is the marginal artery. All right, now let's take a look at the veins, and probably the best way to look at the veins that essentially take blood from the heart muscle be at the back of the heart. We have a very large vein here, and actually if we follow that all the way from the front, let's do that first. So this is a very large vein, travels from here all the way around, following the circumflex artery, all the way around to essentially draining in this big bulge. And this large vein is called the great cardiac vein. Likewise, there's one that follows the back of the heart in the interventricular septum at the back of the heart. And so this is going to be referred to as the middle cardiac vein, and then there's the small cardiac vein. All three of them drain into this large bulge, which we refer to as the coronary sinus. The coronary sinus. Now the coronary sinus drains deoxygenated blood back into the left, or I should say the right side of the heart, and it goes here, right there, into the opening of the coronary sinus as it's draining into then the right atrium. Okay, good. Notice too that the great, the small, and the middle cardiac veins seem to form kind of a fancy T. Can you see the T? And of course, all of them are going to have a convergence here, right there at the coronary sinus. Good. All right, now as there is an anterior interventricular artery in the interventricular sulcus, there's also a posterior interventricular artery right here. And of course it's going to be joining with the circumflex artery, and this of course is the right coronary artery here coming around the back. All right, good. Well, let's take a look now at some valves. If we open up the heart, again, we can appreciate how there's essentially 4 sets of valves. All these valves, incidentally, are part of what we call the cardiac skeleton, and the cardiac skeleton rests in the region of the atrioventricular groove. Let's take a look at this valve first. This one has essentially 3 little sacs that in fact fill with blood while the heart is relaxing. So a relaxed heart is essentially going to be having a draw on the blood coming out of the pulmonary trunk, but as these sacs fill, it prevents backflow of blood into the right ventricle. However, when the ventricles contract, blood travels between the 3 sacs, and that allows the blood to go upward. The sacs collapse, and essentially the blood then travels into the pulmonary trunk. So this particular valve then is referred to as the pulmonary semilunar valve. Semilunar meaning partial moon, and there would be 3 partial moons then, these little sacs, 1, 2, and 3. Okay, and this one has been removed. Since we're still on the right side of the heart, let's take a look at another valve that's traveling between the atria and the ventricle on the right side. And this is referred to as the tricuspid valve. The tricuspid valve, in contrast to the semilunar valve, is going to be open when the heart is relaxing, and it's going to close when the heart contracts. So the semilunar valve opens with contraction and closes at relaxation. The tricuspid valve is going to essentially open at relaxation and close at contraction. Now these valves are regulated by these muscles here, which are referred to as papillary muscles. And the little strings that attach the valve to the papillary muscles are referred to as the chordae tendineae. Chordae tendineae. We also see this kind of rough appearance, sort of gnarly musculature inside the ventricles. And these muscles are referred to as the trabeculae carni, literally the fleshy pillars, trabeculae carni. All right, so that's the right side of the heart. Let's go to the left side, and we're going to see something very similar. Again, we have a valve, but not a tricuspid valve in this case. We're going to call it a bicuspid valve. Another name for this is the mitral valve. It has 2 cusps rather than 3. Again, the chordae tendineae are attached to papillary muscles, and then the surrounding musculature on the interior of the ventricle is referred to as trabeculae carni. All right, one more thing we'll add to this. You can see on the interior of the left atrium, we have these little guys that look almost like sores on this particular model. These are actually the entry points of the pulmonary veins. Remember, the pulmonary veins are carrying oxygenated blood from the lungs to the heart. So because the blood is coming from the lungs to the heart, these are veins. Here's the outside, there's the inside, right? Now, let's just review this one more time. This is the pulmonary trunk branching into two pulmonary arteries. There's a pulmonary artery on the left, pulmonary artery on the right. The pulmonary arteries are traveling to the left and right lungs. This is deoxygenated blood being sent by an artery, because remember, in a way, arteries carry blood away from the heart. Veins carry blood to the heart. So pulmonary veins, pulmonary arteries. The term vein actually comes from the Latin word to cum, venere. Let's take a look at some other muscles now. On the inside of the atria, we have these little muscles that look as if somebody's taken a comb to them. They are called the pectinate muscles, and the term pectinate means comb. Now what will happen is the pectinate muscles will contract, allowing for blood that is accumulated into the atria to be forced into the ventricle, which allows the ventricle to expand. So forced down through the valve into the ventricle allows the ventricle to expand some, which is, again, essentially provides mechanism for contraction thanks to the elastic properties of the heart. We find the same circumstance on the left side as well, the pectinate muscles. If we take a look at the interior of the heart, we see this white disc. The white disc is called the fossa ovale, and essentially our fossa ovalis. And what this is a flap of connective tissue that has closed a shunt that existed prior to birth between the right atrium and the left atrium. In effect, we do not need to send blood to the lungs prior to birth, and so because we're not breathing atmospheric air, we're getting all of our oxygen from our mother's venous blood. And so, in effect, we have this shunt between the left and right heart. However, once we start breathing the atmospheric air, this needs to be closed up, and indeed it does. And this connective tissue then forms this little flap, which we can actually see, again, called the fossa ovale or fossa ovalis. We find a similar circumstance between the pulmonary trunk and the aorta, and this little structure here is called the ligamentum arteriosum. Again, this is a shunt between the aorta and the pulmonary trunk that allows for a mixing of blood on the right and left side prior to birth. This will collapse into essentially just a ligament after birth. So blood stops passing through here shortly after birth. All right, let's take a look at a few what I call auxiliary vessels. These two here are brachiocephalic veins that feed into the superior vena cava. So we have a right brachiocephalic vein and a left brachiocephalic vein. Now these two are essentially veins that are draining both the head and neck as well as the arms. All right, brachiocephalic, arm and head, right? Good. Now if we go here to the aorta, we see these little prongs sticking up off of here that represent, once again, arteries. This particular one is the left subclavian artery, followed by the left common carotid artery. And then the one off to the right side is the right brachiocephalic artery. The brachiocephalic artery is receiving blood from the right common carotid as well as the right subclavian arteries. We don't see those two arteries here, though. This has been cropped so that we don't see that. But notice that all the brachiocephalics are together, the two brachiocephalic veins and the brachiocephalic artery. There's only one of these. Remember, the left subclavian artery and the left common carotid artery drain directly into the, I should say drain, receive blood directly from the aorta, whereas the brachiocephalic artery receives blood from the aorta and will send blood then to the right common carotid artery and the right subclavian artery. All right, well, I think that almost does it. There's one more little vein that I see real quick, This is the azygous vein. This is essentially draining blood around the rib cage. So this is the azygous vein draining then in this particular region, and it's draining into, as you can see, the superior vena cava. All right, well, that's good. So I think that pretty much covers it. So best of luck.